We're going to talk a little bit about PRRS stability. We're going to review a study that we did a few years ago and then compare to results of a newer study that just completed this year. Then we're going to talk a little bit about surveillance or detection of PRRS virus and a little bit on PRRS biosecurity. So a few years ago, we completed the study. We're going to refer to that study here today as the 2013 study, where we had about 61 sow farms that were infected with PRRS virus. We followed them over time, and those herds, they all implemented herd closure associated with the whole herd exposure program, and we followed those herds over time and described the time it took to achieve stability, time it took to achieve baseline production, measured as time it took to recover the same number of pigs being weaned per week. And we also described the total losses that those farms had attributed to PRRS virus. And more recently, in the what's being called the 174 stability study, Bob and Carlos talked a little bit about that. This study was led by Carl, Betlek, and Bob and some others. And the main difference between those three studies was that in this new 2016 or 174 study, there were 107 farms that were enrolled, but they were not required to implement herd closure or whole herd exposure. Few herds did implement some level of herd closure. The majority did not close the herd as the other study did. And some herds did expose their sows with vaccine, and some other herds did not expose sows with anything. And so again, what they have in common was they were infected with 174 virus. Not saying that it was the same virus, but certainly the similarity between those 174 viruses was much higher than in the previous study where we had 144 and other viruses circulating. So let's go quickly here on the results. Briefly, when we see the distribution of time to achieve the fourth consecutive negative test, in a monthly basis, monthly monitoring, time it took to reach stability. Again, not time to negative, but time to achieve that stability, whatever that means today, at least very low prevalence. It took somewhere between 25 to all the way to 60 weeks to get there. And what I would like to highlight here is that early TTS is possible. So altogether, between those two studies, we have enough data to show there was some good proof of concept herds showing that it's possible to reach time to stability as early as 25, 30 weeks to get the fourth negative test. If you go back some 4 weeks to get the first test, we're talking about 10 to 12, 15 weeks. There were a lot of herds already testing negative. So comparing those two results, and the first one that we have here is TTS 50, or the median TTS, median time to achieve that stability with the monitoring system that were implemented. The first study, it took about 38 weeks as median time to reach that fourth test, and the newer study, it took longer, took 44 weeks. We'll talk more about that in a bit, but just talking more here about the other outcomes. Time to baseline production, or again, time it took to recover level of productivity that farm had before the break. The newer herds, in the newer study, we saw that it was sooner. The time to baseline production, it was a median time of 18 weeks compared to 25 weeks, which is consistent with our hypothesis from the first study that the more the virulent the virus is, the more likely the farm and the farm employees and the people are to comply and to really implement internal biosecurity practices such as stop cross-fostering, that kind of stuff, as people nobody likes to see abortions, preventing mortality. So the higher the virulence of the virus, the more likely the herd is to achieve sooner stability, baseline production. Just a hypothesis, but that's our thought today. And one important finding here was the success rate. It was about 80% of farms that enrolled in the previous study, in the 2013 study, reached stability after a follow-up period of about a year, and only about 62% of farms in the newer study reached stability. So that's a big difference, right? Altogether, what we're trying to say with this data here is that we have enough data to start interpreting what's a good outcome, what do you expect for your PRRS control elimination efforts. So back to time to stability, the early herds, they start testing negative. You're supposed to start negative around 10, 12, 15 weeks, and they should be already producing, have reached TTS by week 20. If you didn't reach stability by week 20, that shouldn't be acceptable, right? Because there are many other herds that do reach. And same thing for baseline production. By week 20, herds should be expected to recover productivity. And at a system level, 80% is good, not great, but 60% is not just, it can't be acceptable if TTS is a desired outcome. We understand that not all herds, not all production systems target to produce negative pigs at weaning. Some target time to baseline production, but we offer here a range and distribution of numbers to help veterinarians, producers to make decisions and interpret how good or how bad, what are the opportunities here in terms of management of PRRS infection. Same information here, but just in different visualization. You see here the probability over time to reach stability. If you focus, there are two lines. The red line is the newer study. 2013 is described in the blue line, and you see that the red line, the newer herd, they not only had a delayed stability, but there was considerable difference in the probability of reaching stability at the first place. And same thing if you compare, how about, can we compare the stability of herds that closed and herds that didn't close the herd? And we saw a huge, significant difference there. Herds that had herd closure as part of the program, they did reach stability significantly sooner than those that didn't. And well, I'll skip that, as Bob just talked about the time to stability at birth. It shows, they've shown that, Hunter and Bob, they've shown that time to stability at birth, it happens significantly before stability at weaning. And by measuring stability at birth and measuring stability at weaning, the difference between those two is the opportunity, right? You start producing negative at birth first, and then you still have a number of weeks where you have some lateral introduction, which makes it reasonable to hypothesize or to try interventions like the wean down or like management or other management practices, options or interventions to reduce that time to stability by focusing on the farrowing house at that time where you have evidence that piglets are, or at least most piglets are being born free of or at least failure to detect PRRS virus in their blood. So as a summary so far here, project to reach stability took 60 to 80% success rate if you compare the two studies, 24 to 60 weeks to reach that fourth negative test. The main differences between those 60 to 80%, those 20, that difference in TTS2, it was the difference between the populations were herd closure, whole herd exposure, maybe those two together, and of course there were differences in the PRRS virus itself. So we can't attribute what's going on there, but we could enough to start raising some hypotheses and exploring those hypotheses with field studies. So again, if the time to stability at fairing happened significantly before that one at weaning, it makes us, gives us some strong evidence that the answer, part of the answer to reduce stability might be in the fairing room. So let's explore those studies to go after shortening time to stability. So many different studies or interventions. We're kind of trying to do a little bit of each, talking about biosecurity to reduce the rebreaks. We're going to talk about that in a little bit. Boost herd immunity, as we've shown and seen that herds that have some immunity, they do reach stability and recover productivity sooner, and reduce practices or management practices to reduce that within herd transmission, especially at that time when you start producing negative pigs at birth. That's worth further exploring. Let's changing a little bit of subjects here, talking about surveillance. Surveillance method not only for PRRS, but for the next emerging disease. How fast and how reliable can we detect circulation of antibodies or of the antigen using molecular tools? How fast and how reliable can we do that under field conditions? We understand that if we want to go in finishing sites, it takes a lot of time to bleed or to collect oral fluids or to sample different finishing sites. But what if we go directly at one first point of concentration, which is the abattoir, the slaughter plant, and sample pigs there? So Marcelo Almeida, our graduate student, he's working on this project with myself and Jeff Zimmerman, where we followed 30, little over 30 finishing sites. We collected 10 oral fluids and 10 serum samples from those pigs just prior to going to the abattoir, and within 24 hours we had a separate team at the abattoir, and we collected 3 ropes per group, so following not the same individual pigs, but the same population of pigs, and we sampled them with those population tools using oral fluids. We submitted samples to 3 different VDLs and tested for PRRS RNA, for PRRS antibodies, and for Seneca PCR. And we got the results, and with the results we were interested to compare results between farm and abattoir and across the labs, and measure agreement between labs to understand how explore the reliability of using that approach to surveil, again, not only PRRS or Seneca, but other pathogens out there. So quickly here, we won't share all the results here, but just a few of them. Only 2% of pigs of samples were positive for PRRS RNA by PCR in the serum, and 25% was positive on oral fluids. So not surprisingly, oral fluids detected more virus at the farm than serum. And if we look at the abattoir and look only at the oral fluid samples over there, because we also had some environmental samples at the abattoir, but looking at specifically at the oral fluids, 25% were positive at the farm, and 34% of samples were positive at the abattoir. So we demonstrate here the ability to detect, and we're going to further explore that in the next slides. So looking at the ELISA for PRRS, pretty much all the pig lots or the finishing sites, they were ELISA positive. At 100% had at least one pig with ELISA titers, and at the individual level, over 92 to 94%, depending on the lab, were positive by ELISA. Coming back to the PCR, so looking at individual samples, not the lots, but individual samples, about 2% of serum samples were positive, 24% of oral fluids at the farm, and 28% of oral fluid at the abattoir were positive. And you see here results by lab, right? And this red box shows the agreement between the labs. So for serum samples, if you compare lab 1, lab 2, lab 1 to lab 3, lab 2 to lab 3, you see that the agreement between the labs range somewhere between 97.5 to 91%. So not too bad. But when it comes to the oral fluids, the agreement dropped to somewhere between 82 to 88%, showing some clear opportunities for better adjusting that agreement between the VDLs, analyzing the same set of samples. And if we pull results by group, we had 18% of the groups of the lots, finishing lots, had at least one sample positive in serum. 65% had at least one sample of the 10 positive on oral fluids, and 40% had at least one positive sample at the abattoir. Not very surprising that we found more in the group level, more at the farm than at the abattoir, as we kind of oversampled the abattoir, the farm, with 10 samples compared to only 3 at the abattoir. But we did that on purpose to better understand what's the probability of detecting the abattoir depending on the prevalence in the field. And trying to summarize that with this slide, we see here the probability of detecting PRRS at the abattoir in the y-axis, depending on how many samples were positive at the farm, anything between 0 to 10. And what you see there, to keep it simple, was that the more, of course, the more virus we found at the farm, the more virus, the higher the chance it was to find the virus at the abattoir. So take-home message is still preliminary. We're still exploring the data, and I'm showing here just a limited set of slides. Is that take-home is that oral fluids are easily collected at the abattoir, at least at the power plant that we work with. PRRS antibodies and SVA and PRRS RNA can be detected in oral fluids collected at the abattoir. PRRS RNA detection, it was much higher in oral fluid compared to serum, showing again, it was not surprising, but oral fluid is a very interesting tool for surveillance. And we still need to work on those last couple topics there. There was a substantial variation in agreement between labs, especially for SVA and PRRS PCRs. And we need to further explore. That was just a baby step, the first step, at least to our understanding on exploring this method of sampling and surveilling pigs at the abattoir. But we still need to further explore the farm-abattoir agreement and better describe number of ropes at the farm and at the abattoir, and what's the detection level based on the expected prevalence, number of ropes, pig behavior, that kind of stuff. So it still needs a lot to work on, but we're excited with the results we got so far. And still talking about PRRS detection, we conducted, when I say we, a group from the Swine Health Monitoring Project, Bob, Carlos, in our group at Iowa State, we developed a pilot project with a production system with about 50,000 sows, and we gathered 2 years worth of production data, and we also gathered their weekly information on swine health monitoring project status for PED and for PRRS, and we were interested to understand if we were able to detect, how soon could we detect a PRRS or PED outbreak, looking only at the production data. So we used that same method that Carlos talked about, which is the SPC chart to detect significant changes in productivity numbers, we use that over time to detect changes in abortions, preweaning mortality, and other production parameters. And we found that if you look at, when we looked at abortions, at least in that data set, in that production system, all the PRRS outbreaks had an increased number of abortions compared to the baseline of that particular herd. And all the farms that we looked at, they also had some significant spike in preweaning mortality, right? And it's true to say that there was a spike in abortions in every time we had PRRS in the farm, but there were also some false alarms, at least for PRRS virus, in the sense that we did have some situations, 7 weeks, 7 times where there was a spike in abortions and there was no PRRS detected, at least described. We don't know if it was a mini abortion, a mini outbreak, or anything else. But anyways, considering the reported changes in swine health monitoring project status, this is what we found. And more interesting, we were interested to understand how soon could we have detected those breaks. And so we looked at the time to detect PRRS using each of the production parameters that we're describing here. And we found that in abortions, at least for that data set, we found that there was a spike in abortions up to 4 weeks, in average 2 weeks before, but up to 4 weeks before the reported PRRS outbreak, which makes us think that what if we start monitoring that more closely? Can we detect the outbreaks before we are doing right now? And if so, that would allow, we wouldn't prevent the outbreak because it's already occurred, but can we work on early intervention strategies, or at least review the flows of people and pig movement, so we would prevent the break of the sister farm or the next farm in the production system? So that's where we are headed right now, developing a system to gather that information on a weekly basis and connect that with the swine health monitoring information to try to early detect outbreaks, at least some signs, provide some signs for farms to detect likely outbreaks and have the chance to better early implement the interventions or prevent the next break. And the last thing I wanted to talk about was on biosecurity. So see here a picture of Gustavo Silva. He's a PhD student working on biosecurity, and what he's developing is he's working on the big buckets of events, of risk events in the farm, and we're working on scores. For example, for all the, if you consider that all the scores add up to 1, what's the relative importance of pig movements? What's the relative importance of people movement, pork food product entry, manure removal, all that? So we start using some numbers. We can talk about how we came up with those numbers, but the idea here is to put some numbers on each category, and then after you did that, understand pig movements. When we talk about pig movements, what do we specifically talk about? We talk about semen delivery, replacement pigs, co-pigs, weaning, and then we do the same thing, assign some scores for those, and we do that up to the 3rd level, where for each category there we have some scores. So with that approach, we multiply the frequency of events. So we pretty much use the backbone that Daryl put together for the outbreak investigation, but we focus specifically on number of events on each category. So in a simplified way, we come up with these scores, And what we've done so far with the pilot data with 30 farms, we found that that score was positively correlated 65% with the frequency of outbreaks that those farms had in the previous years. Still preliminary, still we still need to further explore that, but that's enough to call it exciting, at least for us. And that's why I think Bob briefly mentioned about that. We, again, with collaboration with the Swine Health Information Center and the Swine Health Monitoring Project, are working together on this study where the title is Description of Biosecurity Aspects of Herds with Low or High PRRS Incidence, and compare the within and between production system differences on that. So briefly, we are looking for production systems to enroll herds. We would rank their herds in terms of number of outbreaks in the previous 3 years. We would get 3 with low number of outbreaks, and then get 3 with high number of outbreaks, and we would call them relatively low incidence farms, relatively high incidence farms. And what we want to do is is to compare key differences: density, where those farms are located, number of key events like the ones I've showed before, number of pigs weaned, frequency of weaning events, number of people that come in the farm every day, that kind of thing, and selected practices, not the whole thing, but also, and some information on infrastructure. So using a survey that we put together with help from Andrea, from Carlos, and using the information from the Outbreak Investigation Program, we came up with a survey that it takes about 11 to 15 minutes per herd to enroll. So we focus on it's very objective. It's a lot about number of events and a lot of yes and no's. So it takes 11 to 15 minutes per herd. So if a production system, we're asking to enroll 3 herds in the low, 3 herds in the high relative incidence, that's 6 herds. It takes less than hour and a half or a little over an hour to enroll those herds. And with that, we want to explore what are the differences, the commonalities between those herds, and what are the trends, and use their data and their history of frequency of PRRS introduction to develop scores that are specific, at least at this point, not to all the pathogens, but specific to PRRS. That's why we're calling anti-PRRS biosecurity, or we want to be able to measure, and at least with a high correlation coefficient, and predict what's the likelihood of that herd breaking compared to others, and using some specific biosecurity related aspects.